Hi, I'm Dr. Mark Jabor with Paso. Today we're going to be doing what's called a short scar facelift. Sometimes people call it an S-lift or a mini lift. Different name, more limited facelift. Essentially, suction of the neck area. This area right here, an incision will be right here in front of the ear and stop right here at the lobule. It will not go behind the ear or into the hairline on the behind the ear. This skin will get elevated, and then some strong sutures are going to get put in to cause the lift of the face. And then from there, I'll take off the excess skin and we'll close. And the same thing will be done on both sides. So after we get started, we'll come back and I'll show you a little bit more. I went ahead and I made this incision right here along the ear and the sideburn area. So this area has been lifted. The skin has all been lifted. And I've went ahead and I've already put a layer. And you can see, if you can see on the neck there, how that's going to pull that area up there with this suture. So I'll tie that down, and then I'm going to put a second suture that's going to come towards the jowl area, and it's going to give a lift this way. So these sutures are the ones that's doing really the most work on this facelift. And then once that's there, you'll see we'll have extra skin, and I'll trim the skin, and then we'll start closing. We'll come back in just a little bit. Okay, so I put that first suture in. Now the second suture is in, it's going towards there, towards the corner of the mouth, and you can see as I pull on there, what that's going to do to the jowl area, how much of a lift that's going to do. And that's without putting any tension on the skin at all. That's all the stuff underneath the skin, or the smash layer, as we call it technically. So I'll finish tying that suture, and then I'll show you the extra skin that's now available, and we'll trim that, and then we'll close this side here in just a second. Okay, so we're back. So I've closed this side, and one thing of note is that the incision comes, here into the hairline, then it drops, but it doesn't just go straight down. It follows the contour of the ear, especially in females, and this helps break up the scar. People are always worried about, well, I can have a facelift, but will I see the scar afterwards? When you break it up and you put very little tension on it, like what we did, because all the lift was underneath the skin, the scar heals extremely well. 6 months to a year is difficult to see it unless you're 2 or 3 inches away.